Hello, reporting live from ACC 2026 in New Orleans. My name's Dr. Cao. I'm a cardiology fellow at Mayo Clinic in Rochester, and I have the privilege and honor of interviewing Dr. Nancy Sweitzer. Dr. Sweitzer, thank you so much for being here with us today.
It's my pleasure, Dr. Cao.
Yeah, and Dr. Sweitzer, she is the professor of medicine and vice chair of clinical research at Washington University in St. Louis. She also wears multiple hats. She's the editor-in-chief of Circulation Heart Failure, and she also is a physician scientist and a leader of clinical trials in heart failure and cardiology. So I wanted to start off, Dr. Sweitzer, by asking, in your role as editor-in-chief, you have a unique vantage point of emerging science in the field of heart failure and cardiology. What developments in the field are you most excited about, and why?
I mean, it's a hard question, Jenny, because there's so much happening in the heart failure space right now. It's really exciting. I think for me, that one of the most exciting sort of trends currently is the role of inflammation in heart failure and cardiovascular disease even more broadly, right? As we're beginning to subphenotype and really understand the immune system, I think we're going to see important advances in how we understand cardiovascular disease and how we tackle it with therapeutic strategies. One of the most exciting things I think is just single cell RNA-seq, right? So we can see now in the heart, is it the fibroblast, or is it the invading macrophage population, or is it the myocytes themselves that are activating these signaling pathways? And so I see this as an incredibly rich area, and an area where, my bias will show here, but while I trained as a basic scientist and many of my best friends are basic scientists, we really have to understand heart disease in humans, right? Heart disease in mice only gets us so far. And so I do think some of these technologies that are being developed where we can get biopsy specimens of the heart or explanted hearts at the time of transplant and really look molecularly at what's going on and start to come up with some ideas. I also, obviously, the whole CKM world, right? Where heart disease isn't a heart disease. It's a systemic disease. My whole career, I've been really interested in the interaction. I'm a physiologist by training. So the interaction between the cardiac system and the vascular system and, the endocrine system and all the other systems. And I think it's just been hard to study it. We're complex organisms, and figuring all this out has been hard. But now understanding, just often through serendipity, right, that we give diabetics a therapy and realize all of a sudden they're not developing heart failure and there might be something there. And so understanding these interactions, the role that obesity is playing in driving disease in our populations and how we're able to now start to reverse that, also super exciting. But so many devices, if we had infinite dollars, I think I worry a little bit about paying for all the cool toys that we have. But, just in my clinical lifetime, patients who would have died when I started my training, we now routinely save through use of temporary circulatory support while we implement therapies and turn disease processes around and rescue and recover the heart. And really phenomenally remarkable advances.
Absolutely. That's fantastic. Very exciting to hear, about precision medicine. You mentioned new developments in technology and also the integrated approach that I think we really need going forwards.
Yes. And I have to add one other thing too.
Yeah.
That's so important is implementation science, right?
Yes.
I mean, we spend so much time with cool new toys and cool new technologies and therapies, but getting the practicing doctor who is under such incredible pressure to see more patients faster and implementing complex therapy in a 10-minute clinic visit, in my opinion, is not possible. We're doing our patients a disservice with the economic pressures in healthcare, but we do have to figure out how to provide the best possible care to patients in the reality in which we live clinically. And I think implementation science is going to be really important for figuring that out. And also, I hope that we'll get to a value-based system where a 10-minute visit in a complex heart failure patient is seen as the ludicrous endeavor it is, and that we're given the time necessary to provide patients education, engage in shared decision making, make therapeutic changes during a clinical visit instead of just say, well, things seem pretty good, keep going, because that's all we really have time for. So I think we've got to really look at how we're delivering care, how we can better deliver care, and then look at the quality of care we're delivering in the outpatient setting. We spend a lot of time on inpatient quality, but nobody's looking at what's happening outpatient. And in heart failure, the rubber meets the road outpatient, right? That's where we're applying and up-titrating GDMT. We need to pay attention to that, right?
Absolutely. Yeah, those are brilliant points.
Off my soapbox.
Okay. No, thank you so much for that. And I also would want to ask you, as you transition to become a successful physician scientist from a trainee, what were one or two most pivotal moments that, looking back on, you feel shaped your journey?
Yeah, it's hard. My journey's bizarre, and I think everybody's journey is very unique. But I do think there are some themes in making that transition from training to an academic career. You know, as much as we might like it to be different, the coin of the realm in academic medicine is papers and grants, right? And so I think if you want to have a successful academic clinician research career, you need to be writing papers and writing grants. The grants support your time to do the science and write the papers. And the papers are how you build your brand, right? How people know you and what you're doing. And until the world changes phenomenally, that's going to continue. So I think that as you're making that transition, you want to think about, how am I going to structure my research time so that I can have the biggest impact professionally in terms of writing papers, writing grants. And there's no rocket science here, right? It's finding the time to write, putting aside time every day to write, making sure that you're organized in your science. And early in your career, it usually requires two things. One is getting some sort of protected time, either through a K award or some other award, where even if ultimately you want to have a more 50-50 career, which I'm a big fan of for clinician scientists. I think, 50-50 is incredibly rewarding if you enjoy patient care. But early in your career, you do need that really dedicated research time to sort of hit the ground and launch, right? So I do feel like you need some dedicated protected research time early in your career, and you need some degree of focus. You don't want to be so focused that if your project doesn't work, you've got nothing, but you do need to, there's so many interesting things, right? But you need some degree of focus early in your career to, again, build that brand, help people know who you are, build your network, and establish yourself professionally. Now, I will say, from my perspective, the most rewarding thing in my career has been that I'm a dabbler, and I'm the heart failure scientist who can work with the brain scientists who are interested in heart failure all of a sudden, or the sleep apnea scientists, and I like being that person on the team. I love big teams doing big work and big projects. And for me, that's been incredibly fulfilling. But early in your career, that's hard. They're not going to reach out to you first year on faculty to be the heart failure person, right? So I think building your network, building your sponsors, working with senior professionals who are invested in your career. So not just finding mentors, but finding true sponsors, true people with whom you have sort of intellectual synergy, right?
Absolutely.
And it's hard. It takes a lot of time and energy to find those people, but it's so important for all of us.
That's brilliant advice. Thank you so much.
Sure.
And for those of us who want to become a clinician scientist, as your role and leader in clinical and research fields, how would you advise us to balance this clinical and research components of our time?
Yeah, I give all my early career mentees a 2x2 table.
Okay.
And it's got important, yes, no, and urgent, yes, no. Right?
I see, yes.
And we spend a lot of time in urgent, yes, important, no.
Yeah.
Right?
I like that. That approach is very nice.
And your career, your professional research academic career is built in the important, yes, urgent, no box, where you tend not to spend your time because it's not urgent, right?
Yep.
And this is doubly true for clinicians. If somebody's potassium is 7, you can't say, well, it's my research day. You've got to deal with that. That's urgent. And so So I think that's the most important thing, is spending time in that important but non-urgent box where your career development's happening, and finding a way to carve that time out amongst all the other very urgent things that are occurring in your career.
That's very practical and very wise advice. So thank you for that. And last question, if you could go back earlier in time in your training, what is one piece of advice you wish you would have had?
Oh, it's so hard. I think that, I'm going to twist your question a little bit. I wish I could go back now and start, if I could start today.
Yes.
There are so many areas that if I had prescience 20, however many years ago when I was starting out, I would have gotten into, like the, immune system. Although Doug Mann, a great friend of mine, will tell you, I spent my early career in the immune system. It didn't go so well. And now it's, coming around full circle. Devices, they were just in their infancy when I was training, but I think the device world is really cool, and being able to collaborate with engineers. I'm still really interested in device development as it benefits patients directly. I think a lot of corporate device development is focused on making money and less on changing patients' lives dramatically, right? Obviously, our devices do change patients' lives dramatically, but I'd like to see some, wearable or widely disseminatable devices that we could use to really, get people on the right drugs. The simple stuff.
Yeah,
right?
Absolutely.
I would probably, if I were starting today, become an implementation scientist.
Wow. Okay.
And yeah, that isn't what I did, but I think implementation science is really important and really cool, and we need many more smart people doing it.
Yeah, I agree. It's a very under-recognized field. Well, thank you so much for your time and joining us today at ACC 2026 Fits on the Go. Thank you so much, Dr. Sweitzer, for being with us today. And please check out our YouTube video, youtube.com/fitsonthego, and more videos like this. Thank you.